Hey guys, it's Dr. Alicia here from She Found Health. Today we're talking about natural contraceptive options and what those are and what their typical use and failure rates are. These options are great for a certain population of people who, for whatever reason, are not interested in barrier or hormonal methods for contraception. Today we'll talk about 4 different ways of using natural contraceptive methods, including fertility awareness, lactational amenorrhea, coitus interruptus, and periodic abstinence. Now, keep in mind that these methods have a bit of a higher failure rate than our more traditional barrier or hormonal contraceptive methods. So really, they should only be used for women or for couples who an unintended pregnancy wouldn't be devastating to them. So if you are trying to get pregnant, postpartum, have a newborn, and you're interested in this type of topic, make sure to subscribe below and check out our website at www.shefoundhealth.ca. Also, make sure to read our disclaimer in the show notes below. And if you are looking to be pregnant or want to be prepared when you do become pregnant, check out our Preparing for Pregnancy guide. It's a free download, and I'll link it in the show notes below. All right, so the first topic we're going to cover is fertility awareness method. Now, this method is based on the fact that most pregnancies occur from 5 days before ovulation to 1 day after ovulation, and avoiding unprotected intercourse during your fertile window. Now, check out this video that we made that talks about how to find your fertile window. So learning about your fertile window can be done in one of 2 ways. One, we can use symptoms and signs of ovulation, which is what we discussed in our video, or we can use a calendar-based method. So the signs and symptoms are based on cervical mucus, they're based on your basal body temperature, and they can also be based on ovulation predictor kits. Again, check out our video if you want more information around those. We go into much more detail around that. The calendar method is based on a typical cycle of 26 to 32 days from the start of one period to the start of the next, and avoiding intercourse between days 8 and day 19 of your cycle. Now, some women want to get a little bit more specific for their own cycle, so you can do that by tracking your natural cycle for about 6 months. And then you take the longest period in there and the shortest, so the longest cycle and the shortest cycle. So let's say, just for argument's sake, that your shortest cycle was about 26 days from the start of one period to the start of the next, and your longest cycle was 32 days from the start of one period to the start of the next. Now, to figure out where you need to avoid any intercourse during that, unprotected intercourse, you're going to take your shortest cycle and you're going to take away 20 days from that. So let's say your shortest cycle is 26 days. You're going to subtract 20 from that, giving us 6. So the first day that you need to avoid unprotected intercourse is day 6 of your cycle. Then to find the last day to avoid unprotected intercourse, you're going to take your longest cycle, so let's say 32 days, and you're going to subtract 10 from that. So that takes you to day 22. So you are going to avoid intercourse, unprotected intercourse, from day 6 of your cycle to day 22 of your cycle, based on the tracking of your natural cycles over the last 6 months. Now, it's really important to understand failure rates when we're talking about contraception. Failure rates is the rate of getting pregnant despite using contraception of whatever form. We talk about 2 different types of failure rates. One is your typical failure rate, and the other one is your perfect use failure rate. So perfect use is when we use it as it's intended. So these are like laboratory setups, or like very consistent use, appropriately following all the rules and never ever making a mistake. Typical use is more like real world use. So those are the numbers that we generally quote to people when we're talking about failure rates. So the typical failure rate of the fertility awareness method of natural contraception is about 24% per use. So what that means is if 100 women use the fertility awareness method for their natural contraception, every year, 24 women out of 100 women using this method will get pregnant. So it's not a great form of contraception, especially if a pregnancy would be devastating to you. So doing this in conjunction with something like a condom might be a little bit more effective. So why do we think failure rates are so high with this method? Well, there's a few reasons that will affect the failure rates. So how motivated are both parties to avoiding pregnancy. The more motivated you are to avoid pregnancy, the better the method is for you. Are you within a culture that uses these methods frequently and have been for years, so everyone is very aware of how these methods work? Does your healthcare provider or whoever's giving you the information around the fertility awareness, are they knowledgeable in that type of contraception? How much education did the woman get around natural fertility awareness when she started using this method of contraception? And what method of contraception are you using during those fertile days? So are you using coitus interruptus, which we'll talk about later? Are you using a barrier method like a condom? Or are you going completely abstinent, so periodic abstinence, which we'll also get to later? So all of those factors influence how effective or ineffective all of our methods of contraception are. The second type of natural fertility or natural contraception that we wanted to talk about is lactational amenorrhea. Now, this obviously can only be practiced postpartum, and there's 3 pieces of the puzzle that need to happen for this to be effective. And it's actually quite an effective form of natural contraception if all 3 of these things are in place. So number 1, the woman is less than 6 months postpartum. So baby is less than 6 months of age. That's not corrected, that's from baby's birth. So from the time baby was born until the time of end of use of this method is less than 6 months. Number 2 is the woman exclusively breastfeeding or providing her baby with exclusively pumped milk. So is she able to provide her baby with all of the sustenance they need? They're not getting any water, any formula, any other food or drink during this time. And number 3 is the woman amenorrheic. What that means is the woman had a period yet. If the answer to that is yes, then this method is not effective. So we know that women ovulate about 2 weeks prior to their first period, but we also know that only about 60% of those ovulations prior to their first period after having a baby can actually support a pregnancy. So it's not a perfect method, but it's actually got only a 2% failure rate. So only 2 out of 100 women using this, as long as they have those 3 pieces, less than 6 months postpartum, exclusively breastfeeding or pumping for their baby and providing all of the nutrition that baby needs, and has not had their first period postpartum, it's actually a pretty good form of birth control. Now, again, if another pregnancy would be devastating to you, it's probably good to add in a barrier method like a condom on top of it, but it's a pretty reasonable form of birth control postpartum. The third one we're going to talk about is coitus interrupted, or the withdrawal method. This is when the man removes his penis from the vagina and takes it away from the external genitalia before he ejaculates. This is based on a few different things. 1, the man recognizes when he is going to ejaculate. 2, he has the control to remove himself from the situation before that happens. Now we know that some pre-ejaculate can contain sperm that is motile enough to result in a pregnancy. So it again is not a perfect method, and it's very much user dependent. So the typical use failure rate for this is about 22%. So 22 out of 100 women who are using this form of birth control will get pregnant every year. So the last but certainly not least form of natural contraception is abstinence. So this means that not having any penetrative intercourse with penis in vagina or near vagina, as we talked about with the coitus interruptus, at all. This can be a really effective form of birth control. Some people use this in addition to the fertility awareness. So during those fertile windows, they'll practice periodic abstinence. So they'll just be abstinent during those that fertile window, as opposed to all of the time. And some people just practice abstinence. Obviously, that is an extremely effective form of birth control, as long as you're doing it. So there you have it. The 4 most common types of natural contraception out there. We talked about fertility awareness, so either doing it by symptoms and signs of ovulation or using a calendar method. We talked about lactational amenorrhea, again, only in specific women who are less than 6 months postpartum, exclusively breastfeeding, and have not gotten their period back. We talked about coitus interruptus, or the withdrawal method, and we talked about abstinence, or a subset of that, periodic abstinence. I hope you found this helpful. We'll do another video on barrier methods of contraception and hormonal methods of contraception as well. Again, if you like this type of content, please check out our website at www.shefoundhealth.ca. Also check out our Instagram at she.found.motherhood and make sure to subscribe below. Have a great day.